Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. Dr. Schwartz, we've seen COVID positivity rates declining in recent weeks in Connecticut and elsewhere, but this does not mean we can let our guards down. What is the latest information you're hearing about the virus?
Well, Sandy, it's definitely a more optimistic time. You can see that, the data in Connecticut, for rates of COVID-19 infections, it's down to like 2.2% in a day, which is, lowest it's been in many months. So that's really good. And, I think to myself, a few weeks ago, the Sturgis 3 unit was full of patients, that were COVID positive. Now it's closed, there's no patients there. You walk, it's nice almost to walk there and not see anybody, with this virus. But even though we're moving along with things, we still have to remember to be vigilant. And that means, wearing masks, avoiding crowds and travel, and most importantly, getting vaccinated. Because again, a lot of what we're seeing for positive changes are with people getting vaccinated. But one of the things that I did want to talk about, and I'm sure people have heard about this, is that there is a variant of the COVID-19 virus that was found in South Africa. And now it's actually been found in Connecticut. Earlier this week, a person between 60 to 70 years old from Fairfield County, was diagnosed with this South African variant. And this individual apparently didn't travel out of the state of Connecticut, and they didn't appear to have been vaccinated. So this is called the B.1.351 variant. And, we talked about this before, that the COVID-19 virus is an RNA virus, and just like the flu virus, they mutate, they change, and this is not unexpected. It is more contagious than the original COVID-19 virus. But, and it was first detected in South Africa in October of 2020, and first detected in the United States only in the end of January of 21. So, this is but it's still important to realize that the vaccines that we are getting are still effective against this virus. So it's important still to get vaccinated and still to follow our infection control practices. I think the thing that's important to remember, and this is what I wanted to emphasize, the more people that get vaccinated, the less time the virus has to mutate, and the less chance the virus has to mutate. So it's very important to continue our vaccination efforts. And I just wanted to make a quote, which I thought sort of summarizes what I really wanted to say medically. This came from Governor Lamont earlier in the week, and I'm just going to read this and kind of say what he quoted. "Seeing another variant in our state reminds us yet again of the severity of this pandemic and reinforces the need for us to take all the necessary precautions, which have proven to be successful over the past year. The virus doesn't recognize state boundaries. It certainly doesn't recognize international borders, which means the responsibility is on all of us to do what we can on a personal basis to mitigate the spread." And to me, that kind of summarized what I was really trying to say to everybody, that we're definitely making progress, we're definitely going in the right direction, but we just have to stay the course. And from my inspirational quote this week, it actually comes from Ruth Bader Ginsburg. And she was a former Associate Justice for the Supreme Court. Unfortunately, she died recently. But this is what she said. She said, "Fight for the things you care about, but do it in a way that will lead others to join you." And I guess what I'm doing through these videos, I'm fighting for things that I care about. I care about stopping this pandemic. I care about keeping our residents safe and getting our lives back. And I think if we just continue, to keep optimistic, see that things are really going in the right direction, just continue to do good infection control practices, wear your mask, and get vaccinated, we're going to get our lives back. So again, I thank everybody for your diligence and hard work, and again, I wish you health and peace. Thank you.
Thank you so much, Dr. Schwartz. We always appreciate all of your information and your insight. And JP, last week we were all very touched by an act of kindness that occurred on the front lawn of Masonicare Health Center. I know you really wanted to share that wonderful story with everyone.
Sandy, thank you. Being out at the front lawn of MAC and watching the parents and the children putting together the snowmen and putting the signs out and looking up at MHC and seeing the residents and staff looking down and waving and seeing that energy just, I warmed my heart. And it told me I said to myself that, this has been a long journey, long time we've been going through with the isolation, restrictions on visitors, and really fighting the battle. Dr. Schwartz talked about our 3 Sturges being full at one time. And that feeling of when is this going to stop gave us a retreat of look at some of the great things that are happening and the family members and friends of Masonicare that are still trying to do things to keep us smiling. And that day brought smiles to everybody, seeing all the snowmen with the signs up saying, thank you, we love you, keep up the faith, just continue to bring hope, and allowed us the ability, I think, to give us that energy that we are winning this battle. And I can't tell you, talking to some of the family members of why they felt they had to do this, and hearing the stories of those that are there every day, I think gives us a time to pause and smile and know that we're in this together. I always say we're Masonicare strong. That's not just about our employees and our residents and our patients that we serve. It's about our friends of Masonicare that see what we're doing and want to help in whatever way we can. And you could clearly see that on that day. And I could tell you stories that I hear constantly of residents or families or staff of what they do each and every day to really bring an extra smile to everybody's face has been truly amazing. When we talk about the vaccine and saying that, I'm going to shift gears a little bit because I want to talk a little bit about the vaccine from the perspective we're actually doing very well in administering the vaccine to our residents, our patients, and also our staff. I think we have 14 more clinics left. And I will tell you that a very, very high percentage of our residents and staff have gotten it. And I'm happy to actually see so many people that have stepped up and said, I am doing this for everybody. I am doing this for my family. I'm doing this for the residents that I take care of each and every day. There's a commitment there to do the right thing with the vaccine, and it's been truly amazing. I actually was up at Asher Village yesterday, and I'm starting to see the energy level go up, because again, everybody's saying, hey, we're starting to come out of this. And I know there's another variant, there's a few variants that Dr. Schwartz talked about, but the vaccine is giving us hope, and you're seeing that decline in number of cases. I was actually just looking at a report today, and it looks like February will see at least half of what the cases were from January. So we're definitely seeing that decline, and that is really what we want to see as we can get ourselves back to some normalcy, and the vaccine brings that hope. Also, we want to see visitors coming back onto our campus, and we are getting close to that. The challenge we have, obviously, is we have to follow certain guidelines from the state and federal government that we are really staying true to. And with that being said, we're getting close to being able to allow certain visitation in our nursing home. We are getting closer to allowing some more normal visitations on all of our campuses. And I think that is really what everybody's yearning for, because again, that isolation is definitely a challenge for all. And with the vaccine and seeing the cases dropping the way they are, we've got some great potential to be able to get ourselves back to some of that normalcy that everybody's looking for.
Absolutely, JP. We have a lot of hope. We just need everyone to stay vigilant and know that we're all in this together.
These masks are not going away for a while. I hope everybody understands this is helping us. The social distancing is helping us. Avoiding the very large crowds are helping us. I know that the governor is loosening up some of those restrictions, but it still needs to be something we need to be vigilant on. Be smart about it. Understand that everything that you've done to this point has been successful. And if we continue to stay that course for a while, we've got a great opportunity to be that state and that nation that has overcome this terrible virus.
Wonderful words to wrap up our session today. Thank you both so much for sharing your time and all of this information with us, as always. And thank you for watching at home. Until we see you next, we hope you'll stay safe and stay well.